Hello, everyone. I'm Dr. Deepak Dhami. I'm a pediatric neurologist from Rajkot, Gujarat. I am practicing at the Exxon Child Neurology and Epilepsy Center, Rajkot. Like today, I'm going to talk about what is epilepsy, what is seizures, and how one can know that whether I have epilepsy or not. So, first, like, what is seizures or epilepsy, and what is the difference between two? So, how our works? Brain works by electric activity. It is continuous flow of electric activity between different areas of the brain, and that is how our area of the brain communicate with each other. So there is a continuous flow, whether we are awake or we are sleeping. There is a flow of electric activity. It is well controlled. But sometimes what happens that this flow suddenly increases. The amount increases, and our neurons fire at one time synchronously. At that time, what happens due to increase in electricity, child or any patient shows some symptoms that is called seizures. So, what are these symptoms? How does it look like? The symptoms can be in form of jerky movement of body, uprolling of eyes, and loss of consciousness. But it is not one symptom. It can be in any form. Like it could be just tearing of loop, or just confusion, or feeling of abnormal sensation in the body, like tingling sensation in one arm. And it can be in jerky movement, can be in the whole body, or it can be in form of movement of one side of upper limb and lower limb. So seizures can have different form according to the where it originates in the brain. So different area has different function, and according to which you can get symptoms. So seizures may last for few seconds to few minutes to few hours. So duration is not fixed. So these symptoms that occur for few minutes is called seizures. But what is epilepsy? So epilepsy is tendency to recur these symptoms. So when somebody gets these symptoms multiple times, that is called epilepsy. Or there are some investigation they may suggest that you may get seizures second time. That is also called epilepsy. So epilepsy is a condition of the brain in which there is a tendency of recurrence of the seizures. So I think we are clear that what is the epilepsy. Now the question comes like, how can you know that you have epilepsy or not? So, whenever you are getting these symptoms once or multiple times, you have to consult physician, particularly neurophysician, to know that you have epilepsy or not. So, when you go to the neurophysician, they will take a proper history, what is happening before the event, at the time of event, what is happening after the event. They will ask about the medical history, past medical history, birth history, any family history of seizures, any other things you are getting recently that is associated with seizures. So, first is the medical history, and then you will need some investigation. You may need some blood investigation, and then investigation regarding the brain, that is EEG and the MRI, according to the need. So, what EEG will show? So, EEG will show the activity of the brain, like what is happening in the brain. It can show any abnormality in between the seizures, and you will have epileptic form abnormality that suggests that you are you are there are chances of getting seizures again, and what type of seizures you are having. So that information we get from the EEG, and for the reason, for the cause why you are having this tendency, for that we need MRI. In MRI can be normal, but you can get some old insult in the brain, or some infection in the brain, or edema in the brain, or you can have stroke. that is decreased blood supply in particular area of the brain. So that may be the various cause of the epilepsy that you can get from the MRI. Sometimes you may need some genetic reports also to know the reason of the epilepsy. And after the diagnosis, the doctor will tell that whether you are having epilepsy or not. And after that, you may need medications for prevention of further seizures. So I think it is clear that how epilepsy is diagnosed and how you can know that you have epilepsy or not. Thank you very much for patience listening.